Hey everyone. So, one thing I thought would be uh, I am on meds right now. I'm having a really good day. But what you just saw me do when I was trying to speak, I think it's part of a Herx reaction. It only seems to happen when I'm on meds. I'm speaking and all of a sudden it's like my brain and I don't know, my mouth hit a wall and the word just stops coming out. My mouth does some weird like jumbled whatever and then start again. So let's start again. I wanted to make a video about my central line, and the reason I thought this might be a good topic is because when I was having it put in a year ago, I was searching and searching for information, trying to find out what normal looks like with it, what everything that it entails, and there just really wasn't a lot out there. So that's what I'm going to talk about today, and I'm just going to bring things in a little bit closer. Got my phone on my bedside table, so it's nice and handy. So this is a indwelling central line. You can kind of see up in here, it's where it's anchored. That's this purple line that's hanging out here. That's what I'm kind of pushing on up there. Really gross. Yep. Doesn't hurt though. So, okay, so I'm going to explain each piece of what's going on. Everything you see that's purple, this straight line, the tube, all of that stays in me. It's been in me for almost a year now, and hopefully having it out soon, so I wanted to get this video done before it was too late. So I guess each piece of it, this little circle is a white foam ring, and it is a antimicrobial foam disc that just goes around the insertion site and reduces the risk for infection. And the next thing you see is this long wing-like thing. It's called a stat lock, and I don't really know exactly how this works because I don't change it myself. That would be really hard. And when we are changing it, I have a mask on, so I can't turn my head and look down so well, but it's all one piece, and what happens is these two purple kind of wings on the side lift up, the line goes through it, and then these get clamped down, and it holds it in place. So I mean, I'm not going to tug really hard, but it's going to stay there, and that's the point. It keeps it from getting yanked out. And this is the packaging for it, but you can't really see what it is because it's all wrapped up, and I'm not going to open these because they're sterile, and if I open them I can't use them. So the next piece is the tip. So this green thing is again, it's another means of keeping my line from getting infected. It's just a little green cap that has like a little foam piece on the inside with more antimicrobial solutions, so that just keeps things a little bit more sanitary. So that just twists off every time I access the line. It gets tossed off and new one will get put back on. But the clear piece here is just the tip of the IV, and I know I grabbed one right here. So this is kind of what they look like. That blue piece gets discarded. It's just kind of like works like a plunger. The saline syringes, you know what? I wasn't going to do this, but it's probably just easier to show you guys. So, green cap, like I said, just comes off, and this just twists. You want to make sure you remove all the air that's in here, because you definitely don't want to push air into the line. That's not a good idea. So you prime it, and like I said, it's just like a plunger, so you just push it in and twist, and then from there you can just push the fluid in. Usually you don't notice it, but sometimes you'll kind of taste the saline or smell it. I'm not really sure which exactly is going on there, but either way. And then after I push it with saline, which I do before and after every time I administer a lactated ringer or a bag of antibiotics. We always finish with heparin so that there's less of a chance of a blood clot blogging up the line and making things a bit of a headache. So that's what that is. So every time I use the IV, that happens at the end. So if I had a green cap with me, I'd put it back on. So that's kind of what that's all about. And then there's always the dressing itself. These are the ones I use. It's a Tegaderm film. I have sensitive skin. These have never been an issue. And like I said, it's almost been a year and my skin has been holding up really great. So for me, these work really well. And another thing that you need for changing them is sterile gloves. So yeah, other than that, there's two different cleaning solutions I guess we use. This one which does not have alcohol in it, so it's safe to use on the line itself. It won't break it down. And then these ones are just regular alcohol wipes. You can get them at any pharmacy. And then the last two things I wanted to show you weren't about the line and the dressing itself, but IV tubing. This is a really long tube and it has a few extra chambers in it. It's not necessary, but just a standard IV tube. And this is a 1 liter bag of lactated ringer, and that's what I use on the days where I don't have antibiotics on board. So it keeps my line nice and clean, it keeps me hydrated, and it kind of helps to push out all the bad gunk that's left behind when the bacteria dies. So I think that's it. If you have questions, you can post them below and I'll do my best to answer them, but I just wanted to put this out there because there really wasn't anything that I could find when I was looking for it, so I hope it's helped someone. It's scary having it put in. I was very, very nervous for a few days. Very nervous with it after the fact. I was scared to get an infection. I've always been very careful with it, and I haven't had an issue. It doesn't hurt, like I said. It did a little bit after I had it put in. Nothing that Tylenol and an ice pack couldn't cure. I was also told that because I'm rather flat-chested, that that discomfort at the beginning would be a little bit worse for me. So if you're a man or a flat-chested lady, then maybe not such an issue, but if you're a little heavier up there, it might be a little bit more uncomfortable. I don't know. But that's about all I can think to tell you right now. And like I said, if you have questions, post them below. And if you want me to talk about anything else, please always, I'm more than open to suggestions to put out whatever people are looking for. Thanks.